Hi, my name is Jo Schifrin. I use she, her pronouns, and I live in Bethesda, Montgomery County, which is District 16.
My name is Sarah Hiller. I also use she, her pronouns, and I live in Towson in Baltimore County, Maryland, in District 42. On the screen is a recreation of a meme that was getting a lot of attention online a few weeks ago, which highlights the contrast between many other countries and the US in terms of our general lack of a healthy and supportive culture around the balance of work and health in this country. In fact, the US is the only industrialized nation without a paid family and medical leave program, and one of just 3 countries in the world with no guaranteed paid maternity leave at all. So paid family and medical leave allows a person to take job-protected time away from work while earning a portion of their wages in the event that they need to care for a family member or to address their own health needs. In 1993, the Family and Medical Leave Act was passed in the United States, granting up to 12 weeks of unpaid time off for certain workers. However, this law does not cover everyone, including those who are self-employed or who work at companies with fewer than 50 employees. And unpaid time off ignores the economic reality that most people need to earn money to take care of themselves and their families. Lost wages can make the difference between affording essentials like rent and groceries and being unable to. Additionally, circumstances that necessitate family and medical leave are often coupled with increased costs, such as medical bills or the costs of raising a new child.
Workers face an impossible choice when the need or desire to care for themselves or a loved one comes at the expense of financial stability. Judaism teaches us to value health and life, to honor our parents, to care for children, and to promote shalom bayit, peace in the home. Judaism also lays out expectations for the fair treatment of workers, including the commandment in Deuteronomy 24:14 to not oppress the hired laborer who is poor and needy. Workers of all income levels and identities can face a serious medical emergency, the need to care for an ill family member, or the joy of welcoming a new child. That said, low-wage workers who are disproportionately women and disproportionately Black and Latinx are the hardest hit by the lack of paid family and medical leave, as they are the least likely to have any employer-provided paid time off and may be living paycheck to paycheck. Without paid leave policies, women with the financial ability are more likely than men to cut back on their hours or leave the workforce entirely in order to focus on caretaking responsibilities due to gendered expectations of caregiving. We saw just this happen in the COVID pandemic. Workers need the flexibility to make choices that are best for themselves and their families, regardless of their income level. The Time to Care Act aims to solve these challenges by providing partial wage replacement when people need to take off a considerable amount of time from work to care for themselves or a loved one.
Maryland's Time to Care Act will establish a paid family and medical leave insurance program through which employees may take off up to 12 weeks of paid leave from work to care for the birth, adoption, or fostering of a child, to care for themselves or family members with serious health or medical conditions, or to address the needs resulting from a military family member's deployment. The program's funding comes from employees and employers, each of whom will make a small mandatory contribution totaling 0.75% of income, or 0.375% from each, for each pay period. During the leave, employees receive between $50 and $1,000 per week based upon the employee's weekly wage and the state's average weekly wage. The wage replacement is partial, that is, the lost wages are not replaced dollar for dollar. However, lower wage workers will receive a higher percentage of their income than will higher paid workers. And this income will come from the insurance fund. An employee is eligible for benefits under the Time to Care Act if they are caring for a newborn child or a child newly placed for adoption or foster care, are caring for a family member with a serious health condition or a disability, if they themselves have a serious health condition that makes the employee unable to perform their job, or if they have a specific need resulting from the military deployment of a family member.
The Time to Care Act includes a broad definition of family members and is gender inclusive. The gender inclusive nature of the policy also assures that, especially in the case of welcoming a new child, this does not apply only to maternity leave. Single parents of any gender and same gender partners are all entitled to the same paid family and medical leave benefits. We believe that all paid family and medical leave policies must be inclusive of trans people and must guarantee protections for folks of different gender identities, as the Time to Care Act does.
Currently in the United States, 9 states, as well as the District of Columbia, have paid family and medical leave laws on the books. Colorado is the newest of the 9 states, having voted for it in a referendum this past fall. JUFJ worked with our partners to pass paid family and medical leave in Washington, D.C. in 2017, and we continue to fight to keep the program strong. Right now, our DC colleagues are fighting back against the DC mayor's efforts to weaken the program during the current budget cycle. Since the fall of 2019, JUFJ has been working to pass paid family and medical leave in the state of Maryland, and we are continuing that work with our partners in preparation for the state session that begins in January 2022. Since this is an election year, the bill must pass early in session to give time for any veto overrides before session ends, because once session ends, all bills are dead and have to start over when the new legislature takes office in 2023. JUFJ is part of the Time to Care Coalition, working to pass paid family and medical leave legislation. The Impact Project has funded a campaign manager position for the coalition, which represents more than 80 organizations across the state of Maryland, including AARP, Catholic Charities, SEIU, the Maryland Family Network, Job Opportunities Task Force, and many others.
The bill's lead sponsors are Delegate Griselda Valderrama of District 26 and Senator Antonio Hayes of District 40, both of whom sit on the committees that will review the bills. The bill will help many people statewide, and it will be particularly helpful to low-income and/or part-time employees who have fewer resources to cope with these changing circumstances, and those with chronic health conditions. Self-employed people may choose to opt into this program as well. The pandemic has made clear how vulnerable workers are and how necessary a program like this is. In a January 2021 poll by OpinionWorks, 88% of Maryland voters said they supported a paid family and medical leave law.
Across the United States, 9 states and DC have passed paid family and medical leave laws, and they are different states of implementation. California was the first to pass all the way back in 2002. And as I mentioned before, Colorado was the most recent. And in the chart on the screen, you'll see that some states are already giving out the benefits while others are currently collecting the funds and will start giving out benefits soon. Due to the nature of these programs, where the fund for the program comes from an insurance fund, payroll tax generally begins a year or two before the benefits are available. In California, data shows that the paid family leave program had a positive impact on businesses, especially on small businesses. The following findings are from Leaves That Pay, Employer and Worker Experiences with Paid Family Leave in California by Eileen Applebaum and Ruth Milkman, and published by the Center for Economic and Policy Research. The business community's concerns prior to passage of the paid family leave legislation that would impose extensive new costs on employers and involve a particularly strenuous burden for small businesses were unfounded. After years of experience with paid family leave, the vast majority of employers reported that it had minimal impact on their business operations. Most employers reported that paid family leave had either a positive effect or no noticeable effect on productivity, profitability and performance, turnover, and employee morale, with the majority of these saying that these were positively affected. Small businesses were less likely than larger establishments, measured here as those with more than 100 employees, to report any negative effects. Prior to implementation, employers also raised strong concerns about the potential for abuse of the program. However, the respondents, at 91% of them, said that no, they were not aware of any instances in which employees of theirs abused the paid family leave program. In other states besides California, we see that in New Jersey, the majority of businesses, both large and small, said the adjustment to the program was easy. And 1 year after Rhode Island's paid family leave program went into effect, a majority of small employers reported that they were in favor of the program.
According to Main Street Alliance, which works to provide small businesses a voice in public policy issues and is part of the Small Business for Paid Family and Medical Leave Coalition, quote, the majority of small business owners support the creation of family and medical leave insurance programs at the state and federal levels, as these programs make the benefit affordable, reduce business cost, increase their competitiveness, and can allow small business owners themselves to take paid leave when the need arises. We'll be sharing these slides with you in a follow-up email, and they include links to additional research and stories about the positive impact of paid leave on businesses, especially small businesses across the country.
JUFJ is proud to have been a lead organization in the campaign to pass precedent-setting paid family and medical leave policy in Washington, D.C. that became law in April 2017. As of July 2020, DC workers finally began receiving paid leave benefits. DC workers currently have up to 8 weeks for parental leave, 6 weeks of family leave to care for a sick family member, and 2 weeks of personal medical leave. The DC program has equity at its core. Lower wage workers get a higher percentage of wage replacement than higher wage earners do, but everyone pays into the program at the same rate. This means that the people who need the greatest support are getting the most benefit. The Maryland Time to Care Act is structured in the same way, and we think that the focus on equity is one of the most important features of the bill. In DC, no businesses have shown any harm from the program so far.
This chart shows the number of claims in the first year of the program. Roughly 10,000 total claims, with about 7,000 for parental leave, 2,300 for medical leave, and just under 700 for family leave. DC's policy covers roughly 500,000 private sector workers. The DC workforce is much larger than that because there are about 250 to 300,000 DC government and federal government workers, but they're not covered because the District of Columbia can't force the federal government to implement a payroll tax. Because the paid family and medical leave program was launched during the COVID-19 pandemic, the total number of claims is lower than expected for two main reasons. There was a lower level of awareness about the program starting, and roughly 80,000 people lost their jobs. When we look at the details of the data broken down to show a racial analysis of which types of leave people are taking, we see that Black and Brown residents make up about 80% of those who took medical leave.
Paid family and medical leave legislation will directly address racial disparities that people of color face by addressing the access to wealth and wealth building, the lack of access to quality healthcare services, race-based discrimination in employment, often resulting in job insecurity, and the need to leave and re-enter the workforce, which over time results in lost wages, loss of seniority and advancement, and women of color suffer the most from the combination of these disparities. In the following graphs, you can see that more white non-Hispanic employees have access to paid parental leave than do Black, non-Hispanic, and Hispanic workers. and more white non-Hispanic employees have access to paid leave to care for a sick family member than do Black, non-Hispanic, and Hispanic workers.
Workers who face barriers to taking the leave they need are disproportionately workers of color or low-wage workers. 16% of workers nationwide needed to take family or medical leave in the last 2 years, but could not do so. This group includes 19% of all women workers, 23% of Latinx workers, 26% of Black workers, and 30% of workers with less than $30,000 in annual income. Latinx workers and workers with annual income of less than $30,000 were least likely to receive any pay during time off.
So, why is it so critical that everyone get involved in this fight for paid family and medical leave? The Time to Care Coalition has grown consistently over the past several years, but the main thing missing from this campaign has been strong grassroots organizing and outpouring of support from individuals and communities across Maryland. The coalition is putting renewed energy into building this grassroots coalition to make this a winning campaign this year by engaging faith institutions and communities, businesses, military families, workers, families, and many others. Ensuring that individuals and families have the time they need to care for themselves and their loved ones is critical to our collective efforts to fight for the world as it should be, not the world as it is. This is an issue of equity that touches each and every one of us in various ways. But without a true groundswell of advocacy from communities across the state, our legislators will not take action to make paid family and medical leave a reality in Maryland. This year, we have the opportunity to change that and to make Maryland a leader in providing the much needed support to workers and their families through the Time to Care Act. We're now going to share with you a story from a JUFJer from Baltimore, Tracie Guy-Decker, who has personal experience about how the need for paid family and medical leave impacts military families.
Hello, and Chag Pesach Sameach. I am Tracie Guy-Decker. One of the many identities I carry around is that of military spouse. My husband is a Chief Petty Officer on active duty in the United States Navy. This year, we are celebrating Passover apart, not because of COVID-19, but because he is currently stationed for a one-year tour in Bahrain. If you are not sure where that is, don't feel bad. Before he was stationed there, I admit I would not have been able to find it on a map. Bahrain is an island kingdom off the coast of Saudi Arabia in the Persian Gulf. When he received orders to Bahrain, we had about 90 days to make arrangements and say goodbyes. I am lucky enough to work at a job that provides leave, and so I was able to take time off from work to deal with the many logistical tasks one faces when one's partner will be gone for a year. Cancel the cell phone, sell one of the cars, arrange for transportation for the days he was on drop-off or pick him before our forced separation. As hard as our situation is and was, we are privileged compared to some military families. Service members who are on deployment rather than a tour of duty, as my husband is, don't have the chance to communicate as frequently as we do. And my counterparts in the reserves or the National Guard can face the logistical and emotional upheaval I went through with as little as 30 days notice. Every military family should have the benefit of paid leave that I was able to access. Military service always takes a toll on service members' families, but we don't have to allow a lack of paid leave to compound those sacrifices. Thank you for listening. And again, Chag Pesach Sameach. Wash your hands and stay safe. Next year, in person.
As I listen to Tracie's story, I'm very aware that everyone has a need for family or medical leave at some point in their lives. As part of this effort, I'm excited to be working with Jews United for Justice to plan education programs, including the Labor on the Bema program for Maryland congregations, so we can show how just a little bit of paid leave can make a huge difference in someone's life. Our goal for these education programs is to engage other members of the community so we can increase the number of people who are as dedicated to working for this bill as we are.
JUFJ will make a copy of the slide presentation available, which includes contact information for the coalition and other resources, articles, testimony, etc., related to paid family and medical leave and Maryland's Time to Care Act. If you have questions about the campaign, please don't hesitate to reach out to JUFJ staff. We're excited to get to work with all of you to pass paid family and medical leave in Maryland in 2022.